Hi and welcome to our telehealth medicine safety information video. I'm Garvin and this video is on Fiasp Insulin. So Fiasp is a new insulin and is to be used at mealtime with a fast acting blood sugar lowering effect. Fiasp is a solution for injection containing insulin aspart and is used to treat diabetes mellitus in adults, adolescents and children over 1 year of age. Diabetes is a disease where your body does not produce enough insulin to control the level of sugar in your blood. Fiasp should be injected up to 2 minutes before you start the meal, and with an option to inject up to 20 minutes after starting a meal. The medicine has the maximum effect between 1 and 3 hours after the injection, and the effect lasts for 3 to 5 hours. The medicine should normally be used in combination with intermediate acting or long acting insulin preparations. So what you should know before you use Fiasp insulin. Be especially aware of the following. So the first is, very importantly, low blood sugar or hypoglycemia. Fiasp starts to lower blood sugar faster if you're allergic to insulin aspart or any other ingredient in the medicine compared to other mealtime insulins. If hypoglycemia occurs, you may experience it earlier with an injection with Fiasp. Also to watch for is hyperglycemia, which is high blood sugar. Also watch if you're switching from other insulin medicinal products. So the insulin dose may need to be changed. Also watch for another medicine, pioglitazone, which is used together with insulin. This may increase the risk of heart failure. Also be on the lookout for eye disorders. So fast improvements in blood sugar control may lead to a temporary worsening of diabetic eye disorder. Also watch for pain due to nerve damage. If your blood sugar level improves very fast, you may get nerve-related pain. So this is usually temporary. Also watch for swelling around your joints. When you first start using your medicine, your body may keep more water than it should. This causes swelling around your ankles and other joints, and this is usually short-lasting. Some conditions and activities can affect how much insulin you need, so you need to speak to your doctor or diabetes specialist. If you have trouble with your kidney or liver, or with your adrenal, pituitary or thyroid gland. Also if you exercise more than usual, or if you want to change your usual diet, as this may affect your blood sugar. If you're ill, carry on taking your insulin and talk to your doctor or diabetes specialist. So regarding children and adolescents, this medicine is not recommended for children under 1 year of age. Other medicines and Fiasp. So tell your doctor or pharmacist if you're taking or you've recently taken any other medicine. So some medicines affect your blood sugar level. This may mean your insulin dose has to change. So there are some medicines which may affect your insulin treatment. Your blood sugar level may fall, which would cause hypoglycemia if you take other medicines for diabetes, sulfonamides for infections, anabolic steroids such as testosterone, beta blockers for high blood pressure or angina. They may make it harder to recognize the warning signs of hypoglycemia. Also acetylsalicylic acid for pain and fever, and monoamine oxidase inhibitors for depression. Angiotensin converting enzyme or ACE inhibitors for some heart problems or high blood pressure. Your blood sugar level may rise or hyperglycemia if you take danazol for endometriosis, and thyroid hormones for thyroid problems, growth hormone for growth hormone deficiency, and glucocorticoids such as cortisone for inflammation, sympathomimetics such as adrenaline, and Ventolin or salbutamol for asthma. The thiazides for high blood pressure or water retention, and octreotide and lanreotide, which treats a rare condition involving too much growth hormone. So they may increase or decrease your blood sugar level, these medicines. So you need If you're on any of those medicines, talk to your doctor or diabetes specialist before using Fiasp. So regarding Fiasp and drinking alcohol, so if you drink alcohol, your need for insulin may change as your blood sugar level may either rise or fall. So you should therefore monitor your blood sugar level more often than usual, and your doctor or diabetes specialist will come up with a plan for managing it properly. For pregnancy and breastfeeding, if you're pregnant, you think you may be pregnant or are planning a pregnancy, you talk to your doctor for advice before taking this medicine. This medicine can be used during pregnancy. However, your insulin dose may need to be changed during pregnancy and closely monitored during pregnancy and after delivery. So careful control of your diabetes is needed in pregnancy. Avoiding low blood sugar or hypoglycemia is particularly important for your health and your baby's health. There are no restrictions on treatment with Fiasp during breastfeeding. Regarding driving and using heavy machinery, having low blood sugar can affect your ability to drive or use heavy machinery. If your blood sugar is low, your ability to concentrate or react might be affected. So this needs to be kept in mind if you're using Fiasp. So how do you use Fiasp? The pre-filled pen can provide a dose of 1 to 80 units in one injection in steps of 1 unit. When to use Fiasp? Fiasp is a mealtime insulin. For adults, Fiasp should be injected right before or like 2 minutes before a meal, with the option of injecting up to 20 minutes after the meal starts. And for children, the Fiasp again injected right before a meal or 2 minutes before the meal starts, with the possibility of injecting up to 20 minutes after the meal has started. When there is uncertainty about how the child will eat, you speak to your doctor for advice on these situations. The medicine has its maximum effect between 1 and 3 hours after the injection, and the effect lasts for 3 to 5 hours. The Fiasp dose, so patients with type 1 diabetes mellitus, the recommended starting dose in insulin patients with type 1 diabetes is 50% of the total daily insulin dose and should be divided between the meals based on the size and composition of the meal. The remainder of the total daily insulin dose should be administered as intermediate acting or long acting insulin. As a general rule, 0.2 to 0.4 units of insulin per kilogram of body weight can be used to calculate the initial total daily insulin dose in insulin patients with type 1 diabetes. Patients with type 2 diabetes, the suggested initial dose is 4 units at 1 or more meals. For use in elderly patients over 65, the medicine can be used in people over 65. So you talk to your doctor about changes in your dose, and they'll go through it with you. If you have kidney or liver problems, you may need to check your blood sugar level more often. Talk to your doctor about changes in your dose. So injecting Fiasp. So this medicine is only suitable for injection under the skin or subcutaneous injection. So where's the best place to inject? So the best place to inject are the front of your waist or abdomen or upper arms. You do not inject into a vein or muscle. And you change the place within the area where you inject each day to reduce the risk of developing changes under the skin. Some of the possible side effects of using Fiasp insulin. Low blood sugar or hypoglycemia is the most serious, and it's with insulin treatment, and it may affect more than 1 in 10 people. It can be very serious. If your blood sugar level falls too much, you may become unconscious. Serious hypoglycemia may cause brain damage and can be life-threatening. If you have symptoms of low blood sugar, take action immediately to increase your blood sugar level. So signs of a serious allergic reaction to Fiasp include local reactions like a rash or redness spread to other parts of your body. You suddenly feel unwell with sweating. You start being sick or get vomiting. You experience difficulty in breathing. You experience rapid heartbeat or feeling dizzy. And allergic reactions such as generalized skin and facial swelling may occur. So you see a doctor if the symptoms worsen or you see no improvement. So other side effects include reaction at the administration site. So local reactions at the place you inject may occur. The signs include a rash and redness and mild inflammation, bruising, irritation and pain. The reactions usually disappear after a few days. The skin reactions, so sign of an allergy on the skin, such as eczema or hives, may occur. So how do you store the Fiasp insulin? You keep this medicine out of sight and reach of children. Do not use the medicine after the expiry date, which is on the carton. Store in a fridge between 2 and 8 degrees and do not freeze. Keep away from the freezing element of the fridge and keep the cap on the pen in order to protect it from light. After first opening or is carried as a spare, you can carry your pre-filled pen with you and keep it at room temperature under 30 degrees for up to 4 weeks. Always keep the cap on the pen when you are not using it in order to protect it from light. Do not throw away any medicine via the waste water or household waste. So bring it back to your pharmacist for proper disposal, and this helps our environment. Some general information on how to use Fiasp Flex Touch. So first of all, you read the patient information leaflet carefully before using Flex Touch pre-filled pen. If you do not follow the instructions carefully, you may get too little or too much insulin, which can lead to high or low blood sugar. Now, you should have given a demonstration by your healthcare professional or diabetes clinic. Do not use the pen without proper training from your doctor or nurse. Start by checking your pen to make sure that it contains Fiasp 100 units per ml. Your pen is a pre-filled dial, a dose insulin pen containing 300 units of insulin. You can select a maximum of 80 units per dose in steps of 1 unit. Your pen is designed to be used with Novo Twist, Novo Fine or Novo Fine Plus single-use disposable needles up to a length of 8 mm. Do not wash, soak or lubricate your pen. If necessary, clean it with mild detergent on a moistened cloth. Do not drop your pen or knock it against a hard surface. If you drop it or suspect a problem, attach a new needle and check the insulin flow before you inject. Your healthcare provider or diabetes clinic will show you how to use your device initially. If you're unsure, you need to contact your doctor or by diabetes centre immediately for assistance. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 for more. Thank you for watching. Stay healthy and stay informed.